Dr. Reid, can you talk a little bit about the lifestyle that you have? You threw a lot of numbers at us in terms of the hours that you work, but I'm not being a doctor, I don't quite understand.
The easy answer is I don't have a lifestyle. Okay, I know that's, but yeah, I work Monday to Friday, 8 to 4. I work every third or second day as a 24-hour shift. So although my pay stub may say 75 Q2 weekly, every 2 weeks, it's an awful lot more than that.
So every second or third day, you're working a full 24-hour shift in addition to the Monday to Friday to 8 to 4?
Mm-hmm. Yep.
That's actually relatively common. I don't think people quite understand that.
Most of us do. To put it in perspective, perhaps, if I've got a kid in ICU, youngster in ICU, patient, and I'm there frequently, the parents are always saying to me, "Do you ever go home?" And no, you don't. You have lazy boy chairs in your office so you can have a place to park.
Is this mandatory on call? Is that like you're doing 1 and 2 call, 1 and 3 call, or is this just a requirement because you don't have that third or fourth prop body?
Well, it's a little bit of both. I mean, I'm not going to walk out. An intensive care physician is not going to walk out of the unit on a sick kid just because it's hour 23 or whatever. You don't walk out. You stay, and so you live there. You have a lazy boy chair in your office.
So if every second or third day you're doing 24-hour shifts, Monday to Friday 8 to 4, that's your 40 hours. And then it's an extra 16 for each of these 24-hour shifts you do. So you're potentially doing, what, 82 hours a week on a regular basis?
Oh yeah, that's not that unusual. But we're not paid for it. We don't bill for it. It's just there's no record kept other than my record of what we do. It's not unusual. A weekend is Friday, Saturday, Sunday. So that's 72 hours. Get to know the 24 times table very well. But the hours, politely, are terrible. And most of you know what word I usually use.
So help me understand this. How many hours a week would you say you are at the Janeway working?
There's 168 hours in a week, for those of you who don't know the 24 times table. And I'm probably there on an average week, 100. Or close to it. I don't keep track of it. It's not germane to what I do. There's any number of physicians here who work similar type hours, just not quite as bad. The kids have to be seen. The work has to be done. And more importantly, the kids have to be seen. And so you have to see the kids. If you've got a sick youngster on your doorstep, needs to get into ICU, you're there. We live there. And that's why we're looking for some help, and we're not going to get help unless the government re-evaluates the two-tier system they've developed.
So you work 2.5 weeks a week, essentially at 100 hours. If an average work week is 40 hours, you're working 2.5 weeks.
I know what they put on my pay stub, but we don't actually see that.
Most people in this room right now work between 1.5 and 2 weeks per week.
Yeah, if you go by a 40 or a 30,
that's why we're all here together.
If you go by a 37-hour week or 37.5-hour week, very few of us work 37.5 hours. I don't know whoever thought physicians work 37.5 hours. They don't.
Minister Kennedy, in one of his scrums with us earlier this week, referenced 10 weeks of holiday that doctors are.
Okay, guys, we'll all laugh at once and we'll get it all with.
Is that a good enough answer?
I mean, I know I can list out 10 weeks, but I can tell you that 20 years at the Janeway, I have never taken my full complement of annual leave. Thank you, Jack. Never have. Just haven't.
She couldn't.
You can't. Yeah, the 9 statutory holidays. Most of the time, we have to work those. I think I've worked every Christmas for 20 years.
So, but on that 10 weeks, I just want to ask you about this because the notice they sent out, 10 weeks includes 2 weeks of stats, so that brings it down to 8. Then there's compensatory leave, which is essentially the 5 paid days you get in return for doing the 100-hour weeks and not billing overtime.
That's stuck in the contract somewhere.
But that's essentially what you get in return for working these crazy hours and not being able to bill overtime, right?
That was the first. Most of us had even heard that.
Most of us didn't even know it existed.
Yeah.
But and then
they don't tell you about it.
If you're there 10 years, you get an extra week, so 6 weeks.
But and then 2 weeks of study leave. That's to write your licensing exams, correct?
Yeah,
that's
but some of us have already got that done.
So you wouldn't get to use that again?
No, generally, if you've done your exams once, they don't throw them at you again.
Okay.
Thank God.
If you're passing. And then there's another week of, I believe it's to go to conferences and things like that. How does this, do you get to take advantage of this? How does this work?
Only if I've got someone to take over for me when I leave the province. And that's not always possible. There may be a great conference in Toronto on pediatric intensive care. So making up some dates, second week in April. But there's nobody to cover for me. Can't leave the unit. Won't leave the unit. Most of the guys that I work with tell you, she won't leave the unit. She'll be here. I live here. It's terrible, but throwing money at it won't. I need people, and the only way we're going to get people is if you throw money in the system to get people, which means get rid of the two-tier system. I don't know if you have any idea what we make, but let's put it this way. I make significantly less, despite 20 years of experience and all the education. I make significantly less than the
Most physicians.
most physicians. Thank you. That'll do it.
Yeah.
So if you look at what the base salaries are now, it's $180,000 for a medical specialist base, plus whatever stipends and other things you get.
Not always stipends. Not always stipends.
But just look at a base salary, and it's $255 for the oncologist. When this is all done, I think you'll be up around $240, and they'll be around $270 something. There's a $37,000 wage gap.
I have not actually sat down with a pencil, so
Not
don't.
necessarily. Do you want to address that?
On base salary, this
Yeah,
is...
I guess another point, with what's been offered, from what we understand, is that our group of salaried specialists will have to do something called shadow billing. And so shadow billing is you work your regular work week, but you pretend almost like you're a fee-for-service. So everything you do, you have to find a code for it, and then there's a certain amount of money associated with that. And then if you bill enough, I guess, then you will get that increase that the government is offering. For example, a place like intensive care where there's not a high volume of patients, and that's a good thing. We don't want, too many very sick children, but it's a low volume, but they require a tremendous amount of work. Somebody who works in intensive care is not going to be able to bill enough shadow billing to even get the increase. So, that for us is a major, major concern, and it has not been addressed. We don't really understand what the rules around this shadow billing are. And, so in intensive care, for example, the base salary may stay the same. There may not even be an increase, or maybe it'll be 2% or 5%. We don't know. We don't have enough information to understand that.
But, the point I was trying to build towards, just these are the numbers that sort of the NLMA and the government seem to largely agree on these, give or take some of the finer points. But if the wage gap really is $37,000 on base salary, and over that on principal you're leaving, and they either have to staff by heavy recruitment, which you've already pointed out hasn't worked, or locums to cover you off, or, as we've heard from people like Dr. Cooper, they have to essentially shut down pediatric ICU and start flying people out. How much is a locum, and how much is it to fly an intensive care kid out of province? It's obviously, it's more than $37,000.
Okay, I'll throw some numbers at you. It's about $10,000 an hour for government air services, ballpark. I could be way off on that. About that, you've got a pilot and 2 members of flight team and 2 pilots. So there's 4, and the plane and everything else. They're not cheap to fly anybody out. And the kid has got to be stable enough, I'm sorry kid, and the youngster has to be stable enough to move. That's not easy. Because once you're up in the air, there's nothing you can do. There's very little you can do if the kid decides to physiologically act up. The locums are paid, I can't tell you that, I know how much they is, but it's a number that's kept close to people's chests. But it is significantly more than what I make.
What's your ballpark on what you suspect the locum would be?
Oh, 2,500 a day. I don't make $2,500 a day.